everyone, I'm SheWhoFeels, and I'm really excited to be a part of this new channel, TheLovePharmacy. Make people spy what a beautiful idea this channel is. I think it's an indispensable resource. I hope it will come to touch the hearts and lives of many sufferers and their loved ones and their caregivers. So I actually talked to my husband, and he wants to be a part of this too, which I'm really excited about. He has some medical struggles too. He's been through a lot. I think I will ask him to tell his own story at some point. But he's doing well now. He's on his second kidney transplant, and thankfully he's been doing really well. So I am very blessed to have somebody in my life who is so loving and accepting as he is. The universe saw fit to send me this incredible spirit who has blessed me infinitely. I can't even tell you. And because he struggled with health problems, also, we really do treasure the small things that people tend to overlook. Life is precious, and keeping that forefront in one's consciousness is so essential. I'd be so lost without him. My illness began in March of 1994 when I contracted the Epstein-Barr virus and had a very serious case of infectious mononucleosis, aka mono. And my story is pretty rare. The virus actually stayed active and did a lot of autonomic nerve damage, as well as some other multi-system problems, but it took several years to get accurately diagnosed. I've been through just about everything in terms of neglect, mistreatment, dismissal, a lot of things that anybody with a rare disease or invisible disability will know well. So now I have a lot of gastrointestinal issues, dysmotility, labile blood sugar, reactive hypoglycemia. I also suffer from malabsorption, and the malabsorption causes severe chronic nausea, which I deal with every day. But thankfully I have IV antiemetics to help with that. But it's very difficult. All of this is very difficult to live with. I'm sure many of you can relate. Heart failure. I'm pacemaker dependent and on antiarrhythmics for my cardiac conduction. There's a lot of other things going on. Hypothalamic hypogonadism, osteoporosis, chronic pain, viral arthritis. There's a lot going on. I love animals. I have a lot of pets, and there's tons of videos on my channel, on my SheWhoFeels account, and also they bring me a great deal of joy. They're very much therapy, animals, and I recently lost my therapy dog. We had to put her down a few days ago, and it's been really, really hard. She'd been by my side for 11 years. I miss her so much. But yeah, there's a great book called The Four-Legged Therapist that you guys might want to check out if you're animal people. You know, our companions can be very healing. But I strive to maintain an attitude of gratitude and find at least one ray of light in every day. That is so important that we nurture our mental health when suffering with debilitating illness like this. I love to read, although my mental capacity leaves a lot to be desired. I love to write, spend time with my animals, of course, spend time here online. This is my social connection because I very rarely get out of the house. I'm pretty much housebound. I go to doctor's appointments and for procedures and stuff, but otherwise I'm at home online a lot. I find it very therapeutic to connect with others in these situations, to offer support and pay it forward, as it were, to others that are living with similar difficulties. My educational background is in pharmacy and medicine, so I have probably, well, I would say definitely a much easier time than a lot of patients, because with the clinical knowledge I'm better able to navigate my own care and be a part of, decision making. And also I volunteer as a patient advocate, so when I am healthy enough to do so, which basically means that I serve as a communicative liaison between doctors and patients, trying to facilitate better treatment outcomes, better understanding and optimization of the short appointment time. And I am more than happy to help anyone who feels like they could use some support in terms of communicating with their physicians. I just feel that while I was unable to complete my studies, I did come away with a lot of valuable knowledge, and this is a way that I can utilize it to help others, even though I never completed my training. In recent years, I've been pretty stable. My treatment was optimized, but I've been wanting to get pregnant, and so the past few years I've been trying to taper off pain meds because I feel that would be an important thing to do, as well as trying to get my hormones in order. And with this last dose decrease on my pain meds, I'd say the past several months, I've noticed a profound resurgence in dysautonomia symptoms, dysregulation. As far as the autonomic nerve damage to my GI tract, it's pretty bad, but it's gotten worse, and then I'm having more arrhythmias and hypotension, orthostatic hypotension, and postprandial hypotension, pretty bad. I'm really excited to be here and network with other sufferers, and also I'm in a unique position sitting on both the clinician and patient sides of that dynamic, of the care dynamic. And I've also been a caregiver to my late grandmother. She had a lot of problems, and I was her primary caregiver for a number of years. Toward the end, we both lived with my mother at the time, but my mother is not one who copes well. I've also lost a great deal of family and friend support over the course of my illness. Most people just either cannot, but more often than not, do not wish to deal. And I can understand that, having been on both sides, as I said. But I will keep this relatively short because we have time limit on this channel, and also I don't want to bore everyone to death. But I'm here, and I have so much love in my heart, and just know that if you are suffering, you are not alone. And if you are caring for somebody who is suffering, you are not alone. And I hope that we can forge a unity here that will help all involved parties. So thanks for watching, and if you have any questions, feel free to ask. I'm very open about my condition and about raising awareness and advocacy and all of that stuff. So yeah, much love and be well, precious ones. I will see you soon. Bye, guys.